All right, so back and forward, back and forward. That's what it looks like in a car accident. This is what a car accident looks like, just like that. Within about 1/10 of a second, your head goes forward and back. So this is just the bones, obviously. We're looking at just what the skeleton looks like. But you got a lot of soft tissue. You got ligaments, you got muscles, you got tendons, you got all kinds of soft tissue that connects to these areas. So a lot of times people go to the hospital and say, well, the hospital sent me home because nothing was fractured. That's true. That's what the hospital's goal is, to make sure you don't die that night or that you don't need surgery right now, and then they're going to send you home. It doesn't mean that you're okay. So a couple things that we look at if you've been in a car accident or a football injury or a sports injury, and you've had one of these injuries where your head's going back and forth or your shoulders or your elbow get hyperextended, is you want to check in between the joints to see if you actually have stretched the ligament. In that quick little movement like that, oh geez, just like that, that's exactly what happens. That soft tissue breaks. This is cable, and just that little whip, just like that, broke the steel cable. So this is what would happen. If I took an x-ray here, this would still look normal. But if I pull it forward, if I had them do the motion, you would see that we actually broke soft tissue off of here. All of the bone is still intact. Perfect example, unplanned, beautiful, I love it. But the way we treat this though, is if you do have tears or stretches or strains in the things, the ligaments and the tendons that hold muscle and bone together, it's a significantly different treatment plan than if you broke a bone. And it's just as important, because your body will start to heal these ligaments and soft tissue and build up scar tissue, and you'll lose range of motion. And what happens a lot of times if people don't get checked for this stuff early after an injury, then it goes 1, 2, 3 years down the road, and this healing takes place and they lose mobility. And in these areas where they lose mobility is where osteoarthritis starts to happen, because there was lack of movement in that area. So it's very important if you've been in a car accident or have some kind of a sports injury or a fall, and you feel inflammation, you feel pain, or you feel tightness when you're moving around, it's a sign early that some of the soft tissue has been broken, damaged, stretched beyond where it's supposed to be, and it's very critical that that's checked early. So whether you're even a teenager or an 80-year-old, the mechanism is all the same. Now, obviously, the older you get, the less flexible the joints are, which is why it's so much easier to hurt yourself. So if you've been in an accident, fall, car accident, sports injury, and you're feeling any of this, want to get checked, reach out to us.